We can't control much of our health status. I'm Dr. Chad Swanson, and I'm an emergency physician. I'm on a journey to understand and transform our health system. A week ago or so, I posted a video that described the major factors of our health status. And I've been thinking for a while about the question of how much can we actually control our health status. And so if we look here, I'll provide a link to this in the description, but about 10% of our health status is due to our physical environment. And we have some control over that through, of course, where we decide to live, but also we can engage in policy, but we depend on the decisions and the actions of others as well in politics and in our communities. So that's air and water quality and housing and transit. There's also social and economic factors. So education, employment, income, social and family and social support, and community safety. Again, much of that is under our control, depending on the level of privilege that we have, depending on the type of social and other environment that we're born into. But we have some control over that, but it's largely under the control of society and our community and neighborhoods. And then clinical care, access to care and quality of care contributes about 20% to our health status. Other studies have shown that it's lower than that. I would say somewhere between 5 and 20%. And that is under our control to some degree, but there's a lot of aspects of that that are not under our control. How close our clinics are to us, the extent to which the clinic makes it easy and accessible to get treatment. And then finally, healthy behaviors. It would seem that these are largely under our control as well. So tobacco use, diet and exercise, alcohol and drug use, sexual activity. And I think that those contribute to about 30% of our health status. But the more I learn about social networks and the influence that social networks have on our health, the more I realize that even our behaviors are not completely under our control. And I've been influenced by the researchers, Dr. Nicholas Christakis and James Fowler. They wrote this book, Connected, years ago. I'm just going to quote a little bit from this book. We began by studying various health effects. So they studied the health effects of people and then their friends and their friends' friends and their social networks. We discovered that if your friend's friend's friend gained weight, you gained weight. We discovered that if your friend's friend's friend stopped smoking, you stopped smoking. Now, this isn't a direct correlation, but it increases the risk and often unconsciously. So health improvement is largely, I would argue, a collective endeavor. It's something that we do in communities, neighborhoods, families, states, and nations. I would estimate, and this is a rough estimate, that about somewhere between 20 and 60% of our health status is under our direct control. I would say it's a little closer to 20%. And that has serious implications for the way that we approach health care and health systems transformation. I'd love your thoughts, questions, criticisms. Thanks.